Psoriasis is our next topic here. This is an autoimmune disorder where the body attacks normal healthy tissue, causing rapid cell division in epidermal cells, the skin cells, resulting in some very key signs and symptoms. So write these down. Silver plaques and reddening skin. These skin plaques present as rough with raised flat tops, typically found on the scalp and the creases of the body, like the knees, elbows, and even buttocks. So Hesse mentions plaque psoriasis. The nurse would expect to see which type of lesion? Elevated lesion with rough, flat top that is greater than 1 centimeter in diameter. And a second question, plaque psoriasis. The patient demonstrates an understanding of the disease by stating that the symptoms are caused by which change in normal skin? Rapid cell division. Now, in terms of the causes and risk factors, a psoriasis flare-up or exacerbation is typically triggered by an irritant that heightens the body's immune system, making the body attack itself. So triggers include food allergens, trauma, and the 3 S's. S for stress, sickness, and even sepsis or infection. Not sun exposure. Many students get this wrong. This actually helps to slow the turnover of skin cells and limit the flare-ups. So remember, not sun exposure. Now education, big NCLEX tip. Exposure to sunlight is good. A lot of students got that wrong, so just remember, exposure to sunlight is good. Have fun in the sun with psoriasis. Now number 2 is moisturize frequently. Remember, these are good. They will not worsen the psoriasis. A lot of students got this wrong, thinking that moisturizers were bad. But no, they are good. Just think the skin has dry plaques here. We want to keep them nice and sunny and moisturized. Now for pharmacology, we use steroids ending in zone like prednisone. Think zones help to soothe the swelling. But really the most tested here are the immunosuppressants, like methotrexate and infliximab. These are given to help the body stop attacking itself. So let's play this segment now from our pharmacology master course. Now our next immunosuppressant is methotrexate. Now this one is the drug to know for the NCLEX as well as your exit exams. Mainly given for rheumatoid arthritis, as mentioned by Kaplan. This is where the body is attacking its own joints. And psoriasis, where the body is attacking its own skin, and even certain types of cancer to slow the growth of that cancer. Now the mechanism of action is pretty simple. It stops folic acid metabolism, which stops cellular reproduction in the fastest replicating cells. Now the bad news, like all immunosuppressants, the fastest replicating cells in the body are in the blood and immune system, as well as pregnant clients with a growing fetus. So we end up with a very weak immune system, leading to infections, low platelet count, leading to serious bleeding, and even fetal death with our pregnant clients. So the memory trick for methotrexate, we just call it methnotrexate. No pregnant clients, no crowds or live vaccines to avoid infection, and no razors or brushing teeth hard. Huge bleed risk with those low platelets. These are the big no-nos for methnotrexate. So the big key points for your exam come in terms of infection and bleeding risk. So infection risk, the big 3 are we report fever over the key number 100.3 Fahrenheit or 38 degrees Celsius. And secondly, we avoid crowds and sick people. And then lastly, we avoid fresh fruits as well as flowers. Now for thrombocytopenia, that's technically platelets under 100,000. So just remember, under 50 is very risky and under 150 is very iffy. So we monitor those platelets under 100,000. Some big key numbers there. So report bleeding in these various ways. So petechiae, that bleeding under the skin, purpa, or purple spots under the skin, as well as melena, that black tarry stool, could indicate a GI bleed, and even hematemesis, that vomiting of blood, and bleeding gums. So we must report these findings to the HCP immediately. Now the Hesse question that was asked for methotrexate, it suppresses B and T lymphocytes, basically meaning it suppresses white blood cells in the immune system. Now, the big teaching point here is we get flu and pneumonia vaccines that are, keyword, inactivated. So flu vaccines are not contraindicated. But what is contraindicated is live vaccines like herpes zoster. So no live vaccines, so don't be tricked, guys. Now, lastly, no pregnancy because methotrexate is not baby safe. We must teach the patient to use birth control. So one question bank said, no pregnancy until 1 menstrual cycle after treatment is resolved. Another quiz bank said, no pregnancy until 3 months after treatment is finished. And a third said, men, no trying for a baby until 3 months after treatment with methotrexate is complete. Now, don't let the NCLEX trick you here. There's no need for frequent eye checkups since it's not eye toxic. So remember the differences with the memory trick. Methotrexate, we say methotrexate since no babies. And hydroxychloroquine is eye damage for that immunosuppressant. Now that's how you know the differences. Next up, we have TNF, which is tumor necrosis factor inhibitors. We have the drugs etanercept, infliximab, and ipilimumab. Now, these are other immunosuppressants given to autoimmune disease patients where the body's attacking itself. So the memory trick we use is etanercept intercepts the immune response, causing immunosuppression. And MAB ending is MAD immunosuppression. So ipilimumab as well as infliximab inflicts MAD immunosuppression. Now the key points to write down, like all immunosuppressants, the big thing is to report to the HCP elevated WBCs as well as a fever over 100.3 or 38 degrees Celsius. That's the biggest NCLEX tip there. Fever is always priority above anything else, since a suppressed immune system that has a fever means typically a big infection. Now for patient education, 2 big key points here. Tuberculosis, or TB, can be reactivated. So this can occur with a low immune system, and that was mentioned multiple times on many different quiz banks. That's why a negative TB test is needed before starting therapy. So before starting, as well as yearly follow-ups to ensure that negative TB. Now, if this TB test does come back positive, then a patient has to be treated with anti-TB drugs before starting these immunosuppressants, since it can make the TB even worse. Now, the next point is for vaccines. The yearly flu vaccine is recommended, but no live vaccines. So no herpes zoster or shingles. And we teach clients to avoid infection risk, like avoid crowds and sick people. Now, speaking of, a contraindication, you cannot take the med if you have infections. So a chronic, reoccurring, or even recent infection. For example, a client who's on an antibiotic for a current infection cannot take infliximab or any other immunosuppressant. Now, lastly, let's talk about labs here so that you don't get tricked. So listen very closely. For labs, we report elevated WBCs. Clients with infections will normally have elevated WBCs, but a client who's immunosuppressed with an elevated WBC or a fever, guys, these are big key words. This usually indicates a severe infection, since the immune system is so suppressed. Next is elevated CRP. Most students get this wrong all the time, so listen close. Elevated CRP is not the most important lab. So exams in the NCLEX will try and trick you here, asking for which option shows the effectiveness of immunosuppressants. So CRP, again, was the most commonly chosen distractors nearly 50% of the time. So very simply, just think about the patho here. Clients with autoimmune diseases already have a ton of inflammation in the body, since the body's attacking itself. And if CRP is elevated, it just represents all inflammation on the body, not specific to the disease. So we expect patients with autoimmune diseases to already have an elevated CRP. So the priority here is elevated WBCs and fever, which indicates a huge infection for those who are immunosuppressed. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor.